So today I'm going to tell you my results for my patients in my virtual lab that we did for class. Patient A complains of syncope. This is also known as fainting or a sudden loss of consciousness. He's concerned because he lost his sister earlier this year to heart disease. During auscultation, we note that the heart sounds indicate a systolic murmur, so there needs to be more tests done. So we did an echo. This shows that the aorta appears to be increased in size, indicating an aortic aneurysm. We also do an MRI that shows that there is no evidence to conclude that there is anything other than an aortic aneurysm in the patient. We then look at their pedigree to find that this trait has a dominant pattern of inheritance. So we need to keep an eye on his family, and that is probably what caused his sister's death. And which that's jumping to conclusions if you don't do an autopsy, but what ifs. Patient B complains of breathlessness and erratic heartbeats. We auscultate the heart sounds, and this shows the first and second, or we hear that the first and second sound are abnormal. The patient is missing the wall. We do an echocardiogram that shows that the patient is missing the wall between the right and left atrium. This is a form of atrial septal defect. We did not do an MRI. We do look at the pedigree, which shows that the lineage supports an autosomal recessive pattern of inheritance. And then we look at patient C, who has dyspnea and fatigue when doing strenuous activity. We auscultate the heart, and the heart sounds show a diastolic murmur. We do an echo, and the mitral valve is thickened and does not seem to be moving properly. We look at his pedigree, and it shows that the condition does not seem to be inherited. None of them had electrocardiograms done. And obviously, with all of these diseases affecting the heart, their complaints point to the heart, because if your heart cannot pump effectively, then oxygen is not moving throughout your body, so you can have shortness of breath, fainting spells or lightheadedness, and dyspnea, fatigue, especially with activities, sometimes without, and you're going to have dysrhythmias. That's all I got.